Hello and welcome to the Quality Champion Forum voiceover PowerPoint for the May and June agenda. I'll briefly give you an overview of what happened in the forum. We also ran at the same time the Quality Champion workshop. We gave a brief overview of our updated pillars for the quality improvement team, drawing attention to our foundations, which actually now we've changed so that it shows our vision. And there have been some other changes within the pillars themselves, which we will go through at a later date.
Hello, I'm Sue Pender and I'd like to introduce you to the clinical supervision framework that we have introduced across City Healthcare Partnership. In 2018, we ran an online survey inviting all our clinical staff to tell us about their experiences of clinical supervision. Some of the key findings are listed on this slide, and these were beneficial to us in helping us to underpin the development of our framework. At the time, we didn't have a specific clinical supervision framework, although this was briefly included within our organisational supervision policy. But as this slide shows, we recognise the real importance of developing a clinical supervision focused framework, and this has allowed us to be able to specify some of the key principles that we should focus upon. Our aim was to promote a high standard of clinical supervision that would be expected across all our services, and our framework was ratified in April 2019. Within the framework, we offer the importance of regular clinical supervision, what clinical supervision is and is not, the different models of clinical supervision and different approaches, as well as some helpful one-page summary guidance. We have also identified the specific responsibilities of those that receive supervision, those that deliver supervision, and the manager's responsibilities. Of particular note, the framework emphasises that it is the individual's responsibility for them to seek out their own clinical supervision. The framework also offers guidance on how to develop and implement a clinical supervision agreement, a template for a clinical supervision log, and a template for a clinical supervision record. You will find the framework on Connect. Please look at the training diary on ESR for our Introduction to Clinical Supervision training, or contact the Learning Resource team for any additional learning needs or queries that you have. Thank you.
We gave a brief overview of the Quality Matters 2 record keeping organisational re-audit from April 2019. This included the increased benchmark of 80% and over now for a green. Anybody scoring 80% and over and attaining green are now not being re-audited until next April. All these services were reminded that they must continue with their audit frequencies and the reviewing records in supervision to maintain that green score. Anybody that scored amber must make contact with the quality improvement team if they wish to have support to progress. Anybody scoring red were advised that they should have already been contacted by the quality improvement team who will work with you to progress this score and increase your record keeping audit. All services were congratulated on the general increase of record keeping audit scores within the organisation. From the start which was September 2017 and the baseline audit, we had a number of services at 65 with an average score of 30 and a most frequent score of 0. This has increased to, in the April 2019 re-audit, we had 69 services audited with an average score of 80 and a most frequent score of 90. We showed you some graphs just to illustrate the fantastic increase in scores and celebrated with all quality champions and asked them to take the message back to their teams, as this is a real achievement. We reviewed the clinical effectiveness priorities for improvement over the next year, which was working and supporting each other to be able to be efficient and effective, and look at quality improvement for everybody, which would capture some of those quick wins. To achieve this priority for improvement, CHCP will be launching the 15 seconds 30 minutes or 15S 30M initiative at the end of July. 15S 30M is a social movement to reduce frustration and increase joy at work. It's a very quick win quality improvement initiative that encourages somebody to spend 15 seconds on a task now that will save somebody else 30 minutes or more in the future. Increasing joy in the workplace has a direct impact on patient safety, with various evidence supporting this. We reviewed what would make a good 15S 30M mission. It's something you can start today. It only takes a little bit of extra time, hence the 15 seconds. It should reduce frustration. Think about things that you find frustrating within your team or your workplace. You don't need permission to do it, and it should increase joy, and it should be easy to share. We discussed at length some example missions, which we'll cover in the next few slides. We discussed what we could update within a short period of time, whether it be an email signature, including a telephone number, perhaps updating your telephone number on the global or in CHCP directory, and what knock-on effect that could have for somebody. We also reviewed other ideas which will be shared within the 15S 30M CHCP Connect page. We discussed that these examples do not necessarily need to be clinical and can affect any part of the care or work system. It could be refilling the photocopier with paper or cleaning mugs of an evening. Quality champions present were encouraged to get involved with 15S 30M when it launches at the end of July, and to encourage their team and workmates to do so. We discussed frustration within the workplace and joy within the workplace, and gave some of the examples as we've mentioned previously with the email. We discussed how not having our correct phone numbers on our emails or on the global or on CHCP directory could affect other members of staff, and how our mission could help people. So having your correct phone number on your email allows somebody to contact you from that email instead of emailing you back. It also stops that person having to search for your correct phone number and waste time perhaps ringing the wrong phone number or having to ring colleagues to try and get hold of you. That all has a knock-on effect for saving time for other people later on. We reviewed the 15S mission packs and agreed that the next workshop at the Quality Champions Forum would be around 15S 30M, where we would get to complete a mission and make some pledges. All quality champions present were encouraged to share the 15S 30M initiative and overview within their teams, and to encourage teams to get involved, to think of their own 15S 30M or perhaps have a team pledge. Again, it doesn't have to be clinical. It could be around an admin task. It could be around any area that is frustrating for you and your team, whether that's refilling the photocopier with paper at the end of the day or at the start of the day, or perhaps everybody washing their own cup before they leave. Thanks to all who attended the May and June forums. Anybody who was unable to attend, please get in touch and either Lucy or myself will give you an overview of any content you may have missed. Building on from today's workshop around the library and knowledge services, Lucy has arranged for 2 further sessions. If you have not been invited to these sessions, please get in touch as soon as possible. The next forum dates are the 18th of July or the 15th of August. Please check your calendars to see which ones you have been invited to. If you are unable to attend, please get in touch and we will invite you to the alternate date, or alternatively, please send your deputy. If you have any queries around the dates and who you can send, please get in touch. Thank you very much. Goodbye.